Okay, thanks everyone. I think that we'll get started now. So as I've mentioned already, my name is Marty Jansen. I am the Acting Manager of the New South Wales STI Programs Unit, a part of the Centre for Population Health at the New South Wales Ministry of Health. We're very excited for this launch event today for the International Student Health Hub, which is the first significant output of the International Students Consortium, which is a body of interested and involved agencies, individuals and stakeholders working to improve health and well-being of international students in New South Wales. And so we're very excited to present the Health Hub to you today. And it's the result of a considerable effort from a number of partners, and we'd like to acknowledge all of the efforts of the partners that have been involved in the design, development, focus testing and production of the Health Hub, which we'll go into more detail through the program today as well, and also acknowledging the support of Study New South Wales. So before we get started though, I'd like to acknowledge that our launch event today is taking place on Aboriginal lands across New South Wales and perhaps more broadly from where we're all calling in from. And so I'd like to acknowledge the traditional custodians of all of those lands. I'm calling in today from Gadigal country, and so I acknowledge the traditional custodians of the land as well, and extend that respect and extend our respects to elders past, present and future of all of those lands. I'd also like to pay particular welcome to all of our Aboriginal colleagues joining the launch event today. So we have quite a full program for our launch event today. We'll have an official launch from Carolyn Murray, who's from the Centre for Population Health. We'll also have one of our key program managers running through the journey of how we've arrived at this stage of the development and production of this International Students Health Hub. We've got the voice of international student population to join us as well. And then finally, we'll have a tour of the hub site, which we're very excited to showcase to you. So we'll have a live run through of the site and some of its content and some of its features. And we'll finish off with the next steps for the program, particularly in terms of promotion and the important kind of step in making sure the resources are available to all of our international students across New South Wales. So I'll get straight into it. Thanks again for joining us. We're very excited to have you all with us and excited to showcase this new resource that hopefully will fill such an important need for our international student population in New South Wales. Unfortunately, Carolyn Murray couldn't be with us today. She's just been announced as one of the top 50 most influential people in Sydney from her work in coordinating the contact tracing COVID response for New South Wales Health. So she's been encouraged to take a break before she commences permanently in her new role. So we've got a pre-recorded launch speech from Carolyn, and we'll play that for you now.
Good morning, everyone. I'd firstly like to acknowledge the Aboriginal people on the land I'm on today, the Gadigal people of the Eora Nation, the elders past and present, and future leaders. A couple of years ago, the evidence indicated a need for significant work to be done to support international students. The only way we were going to have success is to bring together all of the organisations that support students in New South Wales. The need for a strong partnership to add to the gap in the knowledge and skills and access for these services around sexual health was obvious. The International Student Consortium was established. The International Student Consortium meant to define what the needs were for these students, and we applied for a grant with Study New South Wales. When the grant was successful, we were able to move forward with the project. A willing and strong contribution of a broad range of partners were involved in the development of the Web Hub. The Web Hub, which is being launched here today, will fill such an important need for international students, and I want to thank everyone that was involved. People like Study New South Wales, English Australia, the Health Department, local government, especially the City of Sydney, the health funds, the members of the International Student Committee, and those that work with them. It's an absolute pleasure of mine to be able to launch the International Students Web Hub to you today. Please take a look, it looks fantastic. The team have done a fantastic job, and it will fill a gap that's needed for the international students of New South Wales. Thank you.
Hey, thanks to Carolyn there. We're very lucky to have her involved in the program. And Carolyn was actually one of the key initiators of the International Students Consortium when we first developed the program a number of years ago. So it's nice to have her now almost come full circle to be able to launch this first significant output of the consortium. I noticed a question in the chat facility about whether the recording of this launch event will be made available, and yes, it will. So we are recording today's launch event, and we'll have that available to participants to share with their teams after the event. So I'd now like to introduce Carolyn Slattery, who's one of the program managers at the New South Wales STI program unit, and again, one of the key leaders in the development of the program. And Carolyn is going to run through the journey that it's taken for us and our key participants and key stakeholders in the development of this resource. So I'll hand over to Carolyn now and go through the journey of the International Students Web Hub.
Wonderful. Thanks, Marty. Thanks for the kind words. Firstly, before I start, I'd also like to acknowledge traditional owners of the land that I'm meeting on today, and they're the Kimilwara people, and pay my respect to elders past, present and future. And also like to extend my respect to any Aboriginal people that are meeting with us today. So as Marty said, I'm going to go through a journey. It's quite a long journey. It's a journey over a 2-year window. So hang in there and we'll start the journey. So Carolyn, back in her launch speech, did mention the International Students Consortium, and I think this is a key piece of a group that started all this work in the beginning. So we really needed to bring people together, to bring like-minded people together so they could link the work and explore new opportunities to work together to improve the sexual health outcomes for international students residing in New South Wales. It was important that for the consortium to actually identify a piece of work they could do together in collaboration. So what we firstly needed to do was look at the barriers and enablers for accessing sexual health services and information by international students in New South Wales. So we sort of undertook a desktop lit review and we identified quite a number of barriers for international students around sexual health. And those barriers included limited understanding of sexual health, transmission of STIs and HIV, the role of general practitioners, limited knowledge and understanding of overseas health cover, limited knowledge and understanding of the Australian healthcare system, and how and where to access sexual health services. Other barriers identified was cost and affordability of sexual health care, stigma, beliefs, fear of discrimination, and confidentiality risk concerns. And enablers for accessing sexual health information included sexual health education being provided during university lectures, digital means and online resources, and also the use of videos for sexual health education. Since it was such a large number of barriers and that didn't really give us a point of how we're going to still work together, so we actually undertook a workshop. So consortium members really had to prioritise the barriers of what we were going to address. And while we're prioritising these barriers, we had to consider what did we want to achieve, who would be involved, and how could we make sure that the strategy or initiatives we identified would have reach right across the state of New South Wales. Through this process, we identified health literacy as the first priority that would be addressed. It was identified that an online platform where international students could access reliable, accurate sexual and reproductive health information services would be the way that we could address health literacy as a group. Fortunately, during this same time, submissions for Study New South Wales Partnership Grant opened. 18 consortium member organisations partnered on the grant submission, and we were so delighted when we heard that we were successful in obtaining the grant. The grant was to develop and launch a sexual and reproductive health hub, specifically for international students. Another key part of the application and key for this work was the involvement of international students into the development of the hub. So a consultation process was developed to gain input in regard to the content's hub, design and tone. However, that little thing called COVID got in the way. So we actually had to change the format that we were delivering, we were going to deliver consultation. So we had to move from a face-to-face platform to an online platform. Consortium members and other partners such as rural universities, including Charles Sturt, Southern Cross and UNE, promoted the survey to international students. ACON was a key partner in promoting the survey to the LGBTI community. Students were offered an incentive of $25 to participate. And in July 2020, an online consultative survey was conducted. Oops, now we just got to move. Oh, there we go. Sorry about that. So moving along the journey, 191 international students participated in the survey. The purpose of the survey was to find out what international students needed and wanted to know about sexual health and how the website should actually look. The survey's reach and diversity was really quite wide. Of the participants, 43% identified as male, 22% identified as LGBTI, 45% resided in a regional community, which this was a really quite a positive of COVID, if there's any positives from COVID, because that meant a higher participation rate by international students that live outside of Metro. 69% were aged between 20 and 29. A third had spent less than 2 years in Australia. The top home countries were China, India, Nepal, Southeast Asia and Africa. So over the next couple of slides, I'm just going to provide you a little snippet of some of the data that came from the survey findings. So we might start first on the left-hand side, and we're going to just look at reproductive health. So we found participants, the survey found that 55% of participants were confident about their reproductive health knowledge. But when the participants were asked to self-rate their knowledge, 75% of participants rated it as very low, low or average. When participants were asked, what does reproductive health mean to you? 70% of participants indicated that it meant having access to contraception. So move over to the right-hand side around sexual health. Similar questions were asked, and 64% of participants were confident about their sexual health knowledge. But again, when they self-rated their knowledge, 67% rated as either very low, low or average. Metro-based participants perceived higher levels of sexual health knowledge than their rural counterparts. The top three sexual health information sources that participants provided us was sexual health websites, doctors and nurses, and romantic partners. Participants also wanted to know that they wanted us to know that they needed to know more about the Australian healthcare system, overseas health cover, and STIs. Another really interesting finding was that 90% of participants would like to have more sexual and reproductive health information provided from their education providers. So I'll move on to costs now. So participants wanted to know more about out-of-pocket costs for prescription medication, tests including STI tests, and sexual and reproductive health care. Participants also wanted to know if their overseas health cover covered contraception, cervical and breast screening, pregnancy care, overall costs of pregnancy care, and prescribed medications. The survey also found that participants wanted to know more about overseas health cover for STI testing and treatment, sexual health care, PrEP and PEP, and HIV testing and treatment. So on the right-hand side, we're moving into confidentiality and privacy. The three top concerns for participants were having a positive STI and an HIV test result would affect their HIV, sorry, my apologies, let's say that all again. Positive STI or HIV test result affecting their visa status. Doctor or GP would be sent their results, the universities would be sent their results. That was quite a concern. Also was concerned about the need to inform their employer if they had a HIV. The top 4 legal concerns for participants were legal services for hepatitis or HIV positive students, overall access to legal help in New South Wales, seeking a question to be answered, is abortion legal in New South Wales, and access to help and service after experiencing a sexual assault. So the last slide with a snippet of data is around the Australian healthcare system. In regard to the Australian healthcare system, participants wanted to know more about bulk billing, interpreter costs, Medicare and female doctors. When we asked what would make a source helpful, the 3 things that were indicated was they needed to be trustworthy, have lots of information, and be easy to understand. So the full findings of the survey went on to inform the hub's content, design and tone. A summary report of findings has been developed. And if you have any questions about this data or you would like access to the report, please email Maddie or Andrew. I think they've probably popped their email address in the chat, but it'll also be at the end of the presentation. So that's where you can access that report. So moving on, continuing on the journey, we're coming to the end of the journey, and this is a pointy end. So now we knew what international students wanted and needed to know. The project team then grouped the content into 5 topic areas, and these topic areas being safe sex and sexual health, contraception and pregnancy, the Australian healthcare system, overseas health cover, confidentiality and privacy. This bit of work, the next phase of the work was quite intensive work. The core team of us worked with partners to identify reliable, trustworthy information sources that would provide international students with what they needed and wanted. A website developer was engaged and the website was built. Further consultation was undertaken with international students just to see about, ensure that the website's design and navigation work for them. Findings from that consultation provided input into the final content. The final product was then again reviewed by content specialists and the hub's contributors, and it was also approved by the Ministry of Health. So where to next? Where after today, this launch, we'll be out there promoting. So because of the huge partnership that this project has involved, we have many wonderful partners who are supportive of promoting this website through their established networks. So some of those partners are all consortium members, key stakeholders, LHDs. They'll be promoting it through their established networks, through the provision of social media platforms and templates that we will provide. Also, the hub is going to be launched at the City of Sydney Lord's Mayor Welcome to international students. The other place that it will be promoted quite heavily is in the Insider's Guide, and we'll also be doing a webinar later in the year. So the hub will be monitored regularly once everyone starts hitting it. We'll monitor the analytics, the number of hits, time span and click-ons. Such monitoring will not only be an evaluation tool, but it will help us understand the important topics for international students. I think the really exciting thing about the hub, it's really not a static platform. The websites that we engage are absolutely amazing and have built us a system where information links and imagery can be easily changed by the project team. This will allow us for further development when the development of the hub when new topics or priorities come to hand. So this is my final slide. I think it's a really important slide because it's the acknowledgements of all those wonderful people that have been involved. But firstly, I'd like to acknowledge and thank the international students who were involved in the Lit Review, survey testing, report development and consultations. Your input has been so invaluable. I'd like to also thank and acknowledge Study New South Wales for providing the grant and all of our wonderful partners, grant partners who contributed monies and in-kind support. I'd also like to acknowledge the other key partners who also contributed towards the project in many various ways. I think in conclusion, nearly 50 organisations and services equating to some 300 people across the state of New South Wales have been involved in the hub's development in some form. A huge effort by a large number of people, a wonderful example of what a group of passionate, committed people working together can achieve. Thank you.
Thanks, Caro. So just following from that, obviously there's a lot of effort that's gone into the development of the site and production of the site, and also from such a broad array of partners, individuals and agencies really committed to working to improve the health and well-being of our international student population. So it's a real credit, I think, to those involved, but also the collaborative approach that's been inherent in the work of the consortium, its members, and in particularly the development of this program. And always what's been a feature of the program and the development of this product and the consortium in general is the involvement in input from and promotion of the voice of international students throughout our work. And in that regard, I'd like to introduce an international student who's with us today, Susid Kumar, who's going to talk about his experience of being an international student in New South Wales. Over to you, Susid.
Hi, everyone. I'm Sujith. And first of all, I want to say, I'm just kind of touched by the amount of commitment that has been shown to international students' well-being, at least in New South Wales. So thanks, everyone. I'm currently finishing my PhD at UNSW. What I'll be doing is just give a bit of background as to where I've come from and then, my experience working on this. So I come from Singapore, where sexuality and sexual health education for LGBTQ communities is pretty much non-existent, as it is in many parts of Asia. The only thing that we are told is that same-sex sexual activity between males is an offense, even though it's not enforced. So we know little, if anything, about PrEP, how to keep yourself safe. What we know, is what AIDS looks like, how it's the worst thing that can happen. The Kaposi sarcoma lesions and so on. That's what we're taught in science classes. Also, a few years ago, the country's Health Promotions Board, they put up an online resource guide that was remarkably progressive and sensitive to sexuality and gender diversity, but there was a lot of opposition to it, and the resource was removed. So no one talks about sexual health unless you're the tiny minority that somehow manages to get linked to LGBTQ networks, which takes a lot of bravery and awareness of identity and so on. So long story short, I come from a place where things are shrouded in this, in cultural conspiracies of secrecy and shame, where ethnicity and sexuality contribute to a lack of confidence and self-worth. So coming to Australia for the first time in 2008 for a 3-month internship was a breath of fresh air. For the first time in my life, I felt human. There were people who were interested in my views, interested in getting to know me. They seemed attracted to me. It was this explosion of wow. At this point in time, I was just stunned and grateful that people desired me, and I did whatever I could to make them happy because I didn't want to fuck it up. And this included doing physical stuff that I wasn't entirely comfortable with because I assumed that's what people did, right? I didn't know who to talk to. And this was a common experience amongst gay international students who moved to Australia, right? Incredibly common. And I returned to Sydney in 2017, a bit older, more aware of how to manage sexual health risks. But for many international students, navigating desire and identity for the first time, doing that can be very tricky. Australia represents an intoxicating amount of potential and opportunity. Now, remember, we come here with all these ideas about sex and sexuality and disease and shame and a sense of precarity because we are on a temporary visa. And coming to a new country with new health system and often a language that feels very foreign can be deeply confusing and overwhelming. There's also this fear that you're being watched and judged by your peers, that health services will pass personal information to the government, screw up your visa process and so on. Even for me, with all my education specializing on gender, sexuality, and human rights, I didn't know about hepatitis and HPV vaccines and where to get them, whether I could afford accessible HR PrEP and PEP, whether someone would be told to leave the country or be denied permanent residency if they ever get tested positive for HIV. So you'd be afraid to get tested. So for the longest time, I relied on searching through Google for information I needed or through word of mouth. And even though I managed to find some useful information, I didn't know if they were applicable to me as an international student without access to Medicare. And some of my younger friends were worried if their OSHC statements would be sent to their parents. I also had some people coming to me, telling me, oh my goodness, I had someone like, basically assaulting me sexually. What can I do? They came in me like, there's a tear in the condom, so on and so forth. And thankfully, they were marketing the PEP hotline, and at that point in time, so I could have that number to pass to them. So you can imagine my excitement and relief when I learned about how there were plans to launch an international student health hub as a one-stop portal for accurate, reliable, and trustworthy information targeted at international students. And I was really happy to see that there was a serious interest in working with international students to develop that resource. We were invited to shape the website's design and to share our opinion on the sorts of information we felt would be important. As the consultation was anonymously and asynchronously done online in multiple stages, we could participate at times that were convenient to us. And we were encouraged to think more deeply about what mattered to us. So I think, having that sort of online space really helped us to kind of think, negotiate, and sort of set the time aside to think seriously about what it is we want to see from such a resource. I spent some time on the website that we're launching today. I'm really glad to see our feedback taken into account. So it wasn't just a rubber stamping thing. I mean, obviously, the design process is very much influenced by our input, and that was quite heartening. I think this is a wonderful start towards helping international students navigate common health issues, and I have very high hopes for its future. And there's so much potential to making this simple but game-changing resource even more widely available, culturally appropriate, and interactive. For example, a small internship or volunteer program or contests where international students are invited to produce stories, articles, podcasts, videos, talk about their experiences, the Australian health system, challenges they face, and the support they received. So contextual first-hand content or consolidated list of telephone numbers, email addresses, a chat box about, contact points that students could reach out to in case they needed a PEP hotline, for instance, because it can be quite difficult to navigate to the right page in any sort of resource to get to what they need. But overall, this is a significant and incredibly promising step in the right direction. The website looks great. It's more than enough information. I mean, I wish I had this like a few years ago so I could like send it to all my friends. I'm impressed by the commitment of the project's collaborators in doing their best to ensure that international students were very sincerely and respectfully consulted and included. And I'm really thankful to have been a part of the process.
Fantastic. Thank you, Susie. It's really great to have you as part of the program. And also thank you for sharing your story with us today. And I guess I think that's a really nice point to acknowledge how the project team and our broader collaboration has really involved and included, and as Susie mentioned, in a really respectful and productive way, to ensure that the resource is as good as it can be from having the involvement of the population in its design and development. So again, I appreciate your involvement with us, both in the project and your words for us today. So I'd just like to acknowledge now that the International Student Health Hub has been officially launched. So that's the URL of the site that you can go and visit in your own free time. But in order to help us to really understand the layout of the page and its key features, I'd like to hand over now to Maddie Stratton, who's a co-leader of the International Students Place Safe program, who's going to run through the site and just pull out some of the key features and content areas of the sites for just to get you a deep understanding of the site and how to use it, and then how to encourage its use from our networks and populations. Over to you, Maddie.
Thanks, Marty. I feel like my cheeks are sore from smiling today because that was just so great to hear Carrie, the journey, and Sujit, your experience as part of the process. But here we are, and the hub has officially launched. Here it is in all of its glory. This is our homepage, and Marty said I'm going to give you a little run through of the key features, but I'm actually going to go through all of the key features because I'm too excited about all of them to choose my favorite. But this is the home screen. As everyone said, it's that one-stop shop for reliable, trustworthy, accurate, all the words that we've heard already around sexual and reproductive health for international students. You can see on the home page here, we've got this menu bar along the top, but as we scroll through, we actually have 4 key messages here, and it's really recognizing that everyone navigates websites differently. Some people really, go to that menu bar along the top. Other people will find it through these key messages here. The other ways that you can find the content is through these more visual blocks. So you can see safe sex and sexual health, contraception and pregnancy, Australian healthcare system, confidentiality and privacy, and overseas student health cover. So those again are the same pages as if you were to use the menu bar, but just trying to have multiple ways for international students or workers like us to find the content information. The other way too is in this bottom bar along here, it says sitemap. So if you click on that sitemap, it'll also show you a way that you can navigate the hub. So the bottom of the page here in the footer, you can see the international students acknowledged, as well as the grant partners and Study New South Wales there at the bottom. Along this right-hand side of, I'm going to slow right down so everybody can really see it for the first time. On this right-hand panel here, it's what you need to know. This section is really featuring key parts of the hub that we can change up as we go. But I will show you, I'll click on what is a sexually transmissible infection. So the hub is made up of questions and answers. So the answers are not content that we've written. The answers are those referral links that we're connecting an international student asking, what is a sexually transmissible infection? And then when you click on that, it'll take you to PlaySafe New South Wales to answer that question. So you can see here what we were talking about when we were saying connecting to those reliable, trustworthy websites. They already exist. We don't want to reinvent the wheel. We're just linking, and that's, the real purpose of the hub is linking to those websites that already exist. Another navigation tool that we have, which international students also said was important, was this search bar up in the top corner. So you've got the menu bar, the search function, the key messages, the visual tiles, and the sitemap at the bottom. So however you usually navigate a website, you'll be able to do that. I am scrolled back up to the top here, right here where you can hopefully see my mouse. It says select language and it has a Google logo. This is the Google Translate widget. So if I click on that, you'll be able to see all of the languages that our website can be translated to. We recognize that Google Translate isn't 100% accurate, but we have included it on our website as we don't have any clinical information or medical advice housed on the website. They're all, like I said, those questions that link to already existing websites. So there's kind of that reduced risk of information being misinterpreted. And we know that the more that Google Translate gets used, I promise I don't work for Google, but the more that Google Translate gets used, the more accurate it will become. So it's just having that inclusive element there on the hub, and that's at the top of every page. So I'll go into our first page, which is safe sex and sexual health. So this page at the top has what you need to know. There's 4 bars or visual blocks on this page, kind of those 4 key questions and pieces of information that international students said that were important to them. Again, you can see that this question is the same as on that front page around what is a sexually transmissible infection. I will scroll through here more resources. So this is around safe sex, and I'm just going to click on next. You can go through all of these questions. I'm distracted because my face is in the way. There we go, moving out of the way. So you can scroll through here all of the questions that international students identified as important to have on the hub are here, host here, and those links go externally. Sexually transmissible infections. Again, this is around condom use. What is an STI? About testing, about treatment. Are the tests confidential? You can see all of the questions along here. How do you get an STI? HIV is in this next section. What is HIV? A little bit about testing, how to protect yourself. And as we scroll through, you'll see PrEP and you'll see PEP, as Sujit said was important. How often should you get tested? What if you're tested positive? What happens now? Some questions about treatment, some questions about Medicare, ineligible, and of course, the important questions I feel are really, well, who do I talk to about this? And so they've all been included there. I will scroll through so that you can see. Where can I access legal advice? Where can I get tested? And those sites there are all listed. And then of course, the overseas student health cover providers are listed there, as I'll scroll through, as well as Health Direct. And that's HIV. Along this side panel, it's other areas of the hub. So it's really showcasing if you're only one person to go for a very specific question around HIV, this section is right next to it. So hopefully you would kind of, become aware of this section and go, oh yeah, actually I do need access to an interpreter. Oh, I've never really thought about consent, and you can follow those links there. At the bottom of each page, that's those 4 key messages again, as well as that footer with the grant partners listed. So I'll go into now contraception and pregnancy. Contraception and pregnancy page, it's all around those reproductive health topics. Again, you've got those 4 key parts of the hub that we're featuring at the top of this page: caring for your breasts, cervical screening, contraception and pregnancy. So in contraception, I'll scroll through all of the different questions that are asked, and again, those links that go out to external sites. And it's really about those, I guess, those reliable sources, and we had a really great team to make sure that we represented what needed to be represented. So who do I talk to about contraception is in there as well, which is important. Pregnancy as well. How do I know if I'm pregnant? Who do I talk to if I think I'm pregnant? What are those early signs? And what are the options? What's important for international students to know more about? And of course, the cost. Scrolling through to abortion, that question that Caro mentioned in the consultation, is abortion legal? Where can I go? Who can I talk to? And around cost. So I'll scroll down, we're talking about how to care for your breasts. Also along this side is other areas of the hub. And the screening down the bottom here. So what is cervical cancer? What are the costs? Those same questions. So I'll scroll back into Australian healthcare system. So the Australian healthcare system, and you can see that in the data that Caro shared earlier, was a really big area that international students felt that they wanted to know more about. So we've laid this one out a little bit differently, and you've got all of the questions there that you don't have to click through. How do I access healthcare when studying in Australia? What is Medicare? How do we access overseas student health cover and interpreter services? So I'll show you another example of what the hub is made up of. So if I click on what is a GP, it'll take you to Health Direct, and then the answer is listed there. So there's another example. Overseas student health cover was a big topic. So we've got the kind of more broad, what is overseas student health cover? And then it goes through all of the private health insurance in alphabetical order. And each of those pages there are represented just to make it really simple and really clean to be able to see with your eye and find the information that you're looking for. The final page is confidentiality and privacy. Again, a really important one. You know, we heard earlier around concerns about, you know, legal advice, around sexual harassment and crisis support, and also around, is your health information confidential? So those are those really key questions that were said to be really important. And that's all listed on that site. So I'll go back to the home page. I'll check my notes and make sure there's nothing on here that I have missed, but I don't think so. But yeah, I guess we're really excited, and it's crazy to be at this point of the journey. And I love hearing Caro present about that journey, because we've been part of this, all of us in the room today, all, you know, 90 people that are here today have been part of this in some way or another. And we're super proud of this website, and it is going to be ever evolving, and it has been a great collaborative effort. And, you know, that collaborative effort that went into ensuring the accuracy of these links, of, you know, editing and checking for typos, you know, every part of the process has been collaborative. And so I guess, you know, from me and the team, thank you so much for being involved. Thank you so much for being here today. And yeah, we really look forward to international students actually being able to access the hub and share it around. So thanks so much.
Yeah, thanks, Maddie. I think that each time I get the run through of the web hub, it kind of strikes me again and again of how comprehensive it is, how detailed, but also how easily navigable it is, which is really obviously an important component of the site in order to be really engaging and user-friendly for the audience. It also is really clear how representative it is, and that, I think that really shows the involvement of international students in its design and development, that we've really listened to the population about what they want to see in the site, the content that they want, but also how it's designed and how easily accessible the information is as part of this hub. So again, it looks fantastic. I look forward to you all jumping on and using it, exploring it some more, and also in doing so, sharing it through your networks and to the population. The next steps for us is really about promotion. Now we've got to the stage where we've got a really nice product here. Obviously, there will be further build to the product. I think that it's only the very first iteration of this program. There's obviously a lot of other health-related content that's going to be important, or that is important for international student population. And this is kind of the first stage of the development of this site that's only going to build from here. So we're excited to see where we get to now. We've got the first stage of the product out. In terms of promotion, we're really looking for you all to play a part in disseminating this web hub throughout your networks. We do have some resource available to help you to achieve that. So we do have a communications plan for the site. It will immediately go to consortium members, but for those that aren't consortium members, if you're interested to continue to be involved in receiving communications about the program, and also being part of that communication strategy to your networks, peers, and other contacts, then please send Maddie and Andrew your contact information so we can include you in the mailing list. We do have a rolling promotion plan, so pulling out a key feature of the site per month for the initial 6 months, so we can communicate the different components of the site to the audience and through our network. We also have a partnership with Insider Guides, which is a media agency working directly with the international students population. So we'll have some promotion across their channels as well. So we're really looking at not only, how nice a product it is now, but it's only going to be as useful as it is used. And so the next step really is to get it to the population, and we're really looking to all interested and involved members and stakeholders to support us in that work. So again, please give your contact information to Maddie and Andrew if you're not already connected, and then look for those further correspondence that you'll receive. There'll be an acknowledgement for your participation and attendance today. As part of that, you'll get a call to join the mailing list. So look out for that in your email inboxes after the presentation today. And again, it's just to acknowledge the efforts of all that have been involved in the program to date. I particularly enjoyed seeing all of the chat comments about Susith's presentation to us today. So Susith, if you haven't read those comments, please go back into the chat facility and see the fantastic acknowledgement of your words today, and that's been an important part of our program. But really, it is now the task for us all to promote the site through your networks and really to make it as successful as we can in supporting the health and well-being of international students in New South Wales. Thank you all for your attendance today, and thank you all for your work that you do with this important population for us in New South Wales. Thank you.